This is David Holt, your IV consultant, showing you or telling you how to give a full dose of antibiotics from a 100cc bag. I have these super graphics for you. I don't have an IV pump, so we'll get rid of the graphic and move on to what it is that people are doing wrong when they're giving IV antibiotics from a 100cc bag. It's all really down to your teachers, your professors, and your textbooks. All of them tell you that when you program an IV pump to give 100 cc's of antibiotic from one bag, that you program your IV pump for 100 cc's. On the face of it, that's not unreasonable, except that you're going to leave the patient shorted by 31% of his or her antibiotic if you follow those suggestions. Because what you will actually be doing, because there's about a 10 cc overflow in each 100 cc bag, you're going to leave 10 cc's in the bag, and you're going to leave the entire IV tubing full of antibiotic plus any extension which may be between the setup and the patient. This is shown in my second graph, brilliantly set up this morning, which shows that you need to take account of all the dead space. In fact, you need to use some version of Holt's second IV rule for giving antibiotics. You need to add the volume of the bag, which is 100. You need to add 10% for the overfill of the standard bag. You need to add the volume of the mainline tubing, the volume of the secondary tubing, plus any add-ons such as an extension tubing, which is usually 3 to 5 cc's, or the dead space in your PICC or central line. Now, as my super graph showed you there, that comes to about 145 cc's. It may be different every day for every patient, so if you use the Holt second IV rule, you can calculate it, or you can use a fairly neutral number of, say, 140 every time you use a bag of 100 cc's of antibiotic. There are many reasons why your instructors have led you astray over the years. It starts out, they're so focused on teaching you the drop or drip factor that they forget that the IV pump does not actually have a brain, even though they call them smart IV pumps. The people who write the textbooks, which our instructors follow, did their nursing in the dark ages of the 70s and 80s, just before pumps came into use, and they seem to have no concept that in order to give a full dose of antibiotics you have to clear the tubing. So we have a flush bag which is going to flush out the tubing, provided you program your volume to be infused to the VT/BI for sufficient liquid to clear everything out. One of the things that I find when following nurses doing this incorrectly is that they will program the pump, or they will follow the pump's instructions, which has been pre-programmed for 100 cc's, and so they invariably leave the tubing full of antibiotic and also 7 to 10 cc's in the bag. So you've been led astray by your instructors, by your textbooks, by your IV policies, and if you have the initiative to call a pharmacist and ask them what you should put in the volume to be infused, they will also invariably say 100 cc's, because the overfill gives you plenty of liquid to waste. The reality is that you still have that 1 gram of antibiotic in the bag, and even though the bag contains 110 cc's, you have to give every single cubic centiliter of that volume, and also leave none of it in the IV tubing. So that's it. If you want any more information, you can look up Chapter 1 of 7 IV antibiotic mistakes, or you can read more about it on my website.